Video interaction guidance is a technique that's used to improve interactions, and it can be a whole variety of different types of interactions, be they interactions between mothers and at-risk children, adults with disabilities and their support workers, or people developing dementia and their care workers, to even managers. So you can be looking at how a manager is communicating with the people that they're supervising.
Okay. What sort of evidence basis is there on this?
So video interaction guidance, actually I might step back and just say a bit more about it. So it's a process for improving interaction that uses videos, and it uses videos of real interactions between the people. It looks for the better than usual aspects in those interactions, and you might be choosing a clip that's 10 seconds that looks particularly good, that then you can share with partners and actually talk about what's working, why it's working. So it's a very positively framed and focused process of using videos, not a process where you're looking at what's wrong and how am I going to fix this. You're looking for, okay, what's working and how can we expand what's working. Now, video interaction guidance, and there are several other video practices like video feed forward, Marta Mayo, and they have developing evidence base in the different areas in which they've been used. So there's some good evidence around the use of VIG with mothers with depression, that it helps them to be able to look at the videos and see what's working. There's some great evidence around infants, so particularly preterm infants, and supporting parents to be able to see that their baby is responding to them, and that by modifying what they're doing, they're able to also tune into their baby. We're also slowly building some evidence around its use with adults with disabilities, and in particular I've done a recent study where I've used it to support staff who are supporting a woman with Down syndrome and dementia. So supporting them to fine-tune their interactions, what I often call how do I need to be in order to be with you, fine-tune how they need to be when they're with the person, in order to lead to a better, more satisfying interaction for all of the people who are involved.
Okay. How much video, you said 10 seconds, how much video do you take to obtain those golden moments, that 10 seconds worth of really teachable, learnable moments?
Yeah, and I think what you've called, that these are learnable moments, these are moments that you can learn from. The practitioners of VIG would usually record maybe 10 minutes of interaction. They then sit down, so your guide or your VIG practitioner would sit down and have a look at that 10 minutes of interaction and look for maybe 2 or 3 pieces of clip or even still that they can work from. And people often ask, do you ever get into that situation where there's nothing good in the interaction? Well, I haven't. Because you might even just be looking for a still, so you might just look for that one moment when the adult with the disability looks at the support worker, and you might just have that still and be able to talk about that. You might have a 10-second engagement where the support worker is really showing attention to the person, or setting up an opportunity for the person to be able to do something that they wouldn't have been able to do unless that setup was there. You might also be, maybe go nearly as long as a minute, particularly if you're looking at how the multiple turns are deepening the conversation in what's happening. Now, because in VIG, you're not just looking at the interaction between the person with a disability and the support worker, you're also looking at how your interaction as the guide is supporting the support worker to be able to support the person.
Explain that.
So in as much as I might choose a 10-second clip, I'd show that 10-second clip and share that with the support worker. I'd also have a look at a video of me working with the support worker and look at how I'm able to use what we call the principles of attuned interaction to actually enable the support worker to be able to understand and gain a new, stronger understanding of how to engage.
The principles, talk about, what are they about?
Okay. The principles of attuned interaction came out of the work of Harry Beemans in the Netherlands, and have really been, I guess, further developed and looked at by the people in the UK. And they're what often we would think as very, very basic principles for engaging with another person. And often I think we just sweep these ideas away and just think it's too basic. But if we think about the first, perhaps the easiest level of the level or principle is to be attentive. And unfortunately, that's where often things go wrong, is when people lose the capacity to be attentive to each other. So by talking about showing somebody a clip where they have been attentive, okay, what happens when you've been attentive? How do you think that feels to have somebody looking at you? You know, what is it that you're doing that's showing them that you're attending to? So really unpacking a rich conversation to value each of those principles.
What do you think draws people away from that attunement, that basic attentiveness?
Look, it's hard to say in different contexts. So, you know, if you think about mothers with postnatal depression, they may lose that basic attentiveness to their baby because they are caught up in their thoughts, in their processes. So to restore just basic attentiveness is great. Then if you think about the disability field, I think we've neglected the importance of the relationship between the care seeker and the caregiver. We often think that's sort of the fuzzy bit, you know, or that's the nice lady, when in fact it's skill. It's a skillful communicator. So, and also maybe when we think about communication, we've often reduced it down to this idea of what does a person want? What does a person like? And forgot about looking at how does the person be with another person? How does the person know that you're not frightening? And that's the fundamental communication skill. But unfortunately, we've left it out in favour of things that give a more concrete outcome.
What's the other principle? So we've got the basic one. As we go up that, is it a hierarchy or a collection of?
It is more so a collection of principles than a hierarchy. Although the things that are presented sort of later on, and they're not that concrete. So if I run through them, so being attentive, encouraging initiatives, receiving initiatives, developing attuned interactions, guiding and deepening discussions. Now, deepening discussions might be really, really suitable if you're looking at a pair of people, maybe somebody with autism who's able to use speech. Okay, how do you support that person to deepen the discussion that they're having? Or if you're looking at a manager, how do you support that the person that you're supervising to deepen and strengthen what they're thinking about? But then in some of the work again that I've been doing with people with Down syndrome dementia, you're really trying to support the support workers to just see that those moments of attention to each other, a rich, important communication, that maybe when you do set up an opportunity for the person to do an initiative, that's great, but maybe if you're trying to work on deepening the conversation, you might lose the person. So it does vary.
So we know that there's a vast majority of people that can actually benefit this. What about those people in that pre-verbal area? Is this particularly important because of maybe the lack of relationship that happens within traditional day support or even home settings?
Yep. Those people who don't use or seem to understand speech, I think this is just really, really, really valuable for them, because it helps people to, it does a number of things. For the person with a disability, it gives them partners who are able to better engage with them. For the support worker or the family member, it validates what they are doing that is right. And often support workers might be told that when they're doing something wrong, or they might be told in a very general way, oh, you did that well. They're rarely given concrete guidance on exactly what it was that they did that worked, that's making a difference for this person. So them being able to see that the way that they played the music drew the person in. That was the skill that they had, that was the skill, that was them using their skillful interaction. So I think the confidence that it gives to people, because they're able to, and great interactions might be happening. They might be happening behind closed doors because people are embarrassed. You know, if they might be happening on the bus. The person with a disability might smile or make certain sounds when the support worker sings something. But because it's been seen as not necessarily professional behaviour, we've lost the valuing of those golden moments.
So it really is a micro-analysis of communication, right down to its very base levels.
Yeah. It's really paying attention to those details and helping people see, wow, when you did that, what did the person do? What does it feel like when you do that?
So there's benefits not only for the person or client in some cases, but for the worker who's getting some validation. And so you're building on two positives in this whole situation.
And a professionalisation as well. You know, I'm always very focused on saying it's not just because you're a nice lady. You know, people don't respond to me because I'm a nice lady. In terms of people with profound and multiple disabilities that I meet, they're not responding to me because I'm a nice lady. They're responding to me because I'm able to skillfully modify what I'm doing in reaction to what they're doing. I'm trying to use the principles of attuned interaction as much as possible.
So what do you need to do this?
And again, there's multiple levels. To do it properly, you need somebody who's trained in video interaction guidance, and that's a process. That's a 2-day introductory training, and then a series of supervised practice, where as a person who's guiding other people, you're videoing yourself. You're looking at how you are using the principles. You're looking at what your working points might be. And that was a very transformative process for me, because as I went through that training, because I've done a lot of study in the area of adults with profound intellectual and multiple disability and early interactions, I was very good at sitting and telling people what was happening and putting the jargon on there and explaining it. And through the process of my looking at my own videos, I learnt how I needed to activate the person that I was with to be able to explore and find meaning and challenge and grow. And I had to learn how to sit back and listen and trust that other people can get it. Other people can get what works and what they're doing.
So it's a bit like going into a meeting without an agenda.
Yeah. And you know, I see this in lots of people who are training to be VIG guides. They're learning that process of letting go. And I often jokingly say that one of the greatest things for me in developing my skills as a guide was being pregnant, because I slowed down and I started to listen more rather than being so gung-ho of, oh, look here, look what's happening here, and proving my own knowledge. I began to be able to listen to what other people were saying and what it was meaning to them.
So to become, you need that 2-day training course,
Yep.
and then you have to apply it.
Yeah.
So, and the applied part of it is that peer reviewed? Is it you looked at and then feedback? So it's all a constructive feedback. So those people who already had some training in being able to help you with that would look at your work and give you some pointers and directions as well.
Will be a guide.
Or guide you into that.
So just in as much that a guide's job is not to tell the person what to do, but guide them to be able to explore and come to a new understanding or a deeper understanding. As a trainee guide, your supervisor is not there to tell you what to do. They are there to guide you to deepen your understanding and look at different ways of doing it and consider. One of the questions I often present to people is, if you didn't do that, what do you think this would have looked like? So when I'm supervising, or even when I'm being supervised, presenting that question of, you know, what would it have looked like if you didn't do that? If you had remained silent, or if you hadn't touched the person's hand, what would have the interaction looked like there? So it's always that process of reflecting on it, really truly reflecting on what's there. So
what about the consent issue, especially in relation to a person with profound intellectual, physical, multiple disabilities?
Yeah, look, it's important that you do get consent for the work that you're doing, and that's going to differ from agency to agency, from working practice to working practice. There are organisations now that have video reflective practice or VIG or other sorts of practices so embedded in their processes that people know that when their son or daughter, or when the person is going to that organisation, staff are going to use video to refine their skills, refine what they're doing. It can be difficult, particularly in circumstances where it's okay if the person has a parent involved, and you can ask them for permission to be able to do this, and the support worker for permission to be able to do this. It's not so easy when the person doesn't have an active next of kin, which is the situation for a lot of people that I work with. Because then you're also presented with the ethical issue of, do you withhold a potentially useful intervention because the person has no consenting other? You know, I wrote a little article a few years ago and I called it Beep, 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 these phone calls may be recorded for training purposes. And it was playing around with that idea that in telecommunications, it's expected that the interaction will be audio recorded. Now, how much more important is the job that we're doing in engaging people? But we still have this resistance to reflection and recording ourselves. And, you know, that's been born out of fear and a long history of people being criticised. So it is amazing when I do the first session with people and you can see them walk out of the session relieved, because I think they thought they were going to be criticised. I think they thought that they were going to see something bad or something pointless. But when they go through the processes and see, oh wow, yeah, I'm doing something that's working here. I'm doing something that's good.
Because it's a a positive behavioural reinforcement, or
Yeah.
basically for everybody.
Yeah.
What about sharing this? I mean, if it's really successful at maybe a day support or in a school environment or even a nursing facility, aged care accommodation, would you then share it with family because of the good outcome of it? So that interaction could link and be holistic for that person?
Yeah, certainly. So often at the end of a process of VIG, which might be just 3 or 4 sessions over a month or a few months, or in the case of the person with Down syndrome and dementia, I've done that over 6 months to give the support to staff as the person's skills have deteriorated. So what I will usually do at the end, or even during the process, is give a copy of the clips that have been used to people to be able to look at them and share them, and that will be to families and support workers. And you'd also be involved in asking whether the person wanted that shared within the organisation, because it can be an enormous point of pride that we are doing something that's really important and valuable here. So each of those consents and each of those permission issues must be dealt with on a case-by-case basis and respected.
Let's take that opportunity now we've dealt with the consent, because we're going to have a look at a few films, short films. Let's just go through and have a look at the first one, and we've got permission for these to be shown in this film.
So this particular case is a young man who was in a day service, and people in the day service were quite concerned and worried that this person might actually be depressed. He's a young man with autism, and he has used a lot of challenging behaviours in the past, so there's also a lot of wariness about engaging with him, a fear that if you do try something you might open yourself up to risk or him becoming upset. So I sat down with a support worker who was motivated to actually change and improve. We talked about what he'd like to see, and the support worker wasn't able to put it in words exactly, but he wanted things to be better. So we started from that point. I took a 10-minute video, and then I had a look at the video and chose 3 clips. So if we look at the first clip. So I chose this initial clip as the guide because I saw that it reflected the support worker being attentive to the person. I saw the support worker touching the person's head in a really sort of affectionate way, an affectionate, gentle way. I then showed that to the support worker, and while we were watching that together, I saw something that I hadn't seen before. And this is what happened when I sat down with the support worker and shared this video with him. Pushing it away.
Yeah.
What's going on with the thumb there? We go back a wee bit to when you start that, about 55, 56, I just noticed that.
His thumb?
Yeah.
I didn't notice that, yeah.
How nice is that?
Yeah. It's a little acknowledgement or something.
Yeah. He seems to have a lot of things that so easily could be missed.
Yeah.
And this is a very genuine moment for me, that it was something that I hadn't seen before, and I was able to use my curiosity to say, what's going on there? It's important that I didn't sit there and say, look at that, you're doing that, and he's doing this. Instead, I took a posture of inquiry. What's going on? So if you have a look at that clip again and focus in on Craig's thumb, you'll see that he raises his thumb to touch the support worker. That very small movement that wasn't noticed before became a point of discussion about that reframed Craig from somebody who was avoiding interaction to somebody who actually was making contact with another person, wanted to be with another person that we hadn't seen before. Yeah.
Do more watering? It's alright. It's okay. Hello, Faye. I'm hanging out with Craig for the moment. Do you remember how to fold it? No? Alright, that's fair enough. Don't go outside. Can you show me where it goes?
So I chose that clip to share with the support worker to show him how much interest and attention that Craig was showing towards him, that he was interested, that he was engaged in the support worker. Again, through the process of conversation, we were able to co-create a new understanding of it.
We'll probably need a bit of a language warning on this one.
Yeah. So just giving you a bit of a language warning, I do use some swear words in showing this video to share it with the support worker. When I was in early days thinking of my PhD, I was thinking, excuse the French here, but I was thinking of doing shit, bloody hell, fuck off. The non-verbal expressions of swear words by people with intellectual disabilities. Because there is a subtle different way that, oh shit, or bloody hell.
Yeah.
You know, you can tell. So, and it sounds like you're sort of dealing with that there, that he's got these sounds that are sort of saying, oh bloody hell. They're not saying fuck off. Yeah. They're saying, this is a bit difficult.
Yeah.
Yeah.
Okay. Yeah, that's a good way of looking at it. Because now you say that, there's the ones that are like, oh, really? Like, bloody hell, you're making me do this.
Yeah.
And then there's the ones like where it gets really heightened.
Yeah.
That's the fuck off one.
Yep. Yep.
Yeah, and with the goes like that.
Okay. And where's that sort of sitting?
I'd say that's close
on the
to
swear word.
Yeah, that's close to the top. Yeah.
Okay.
Yeah.
It's really good because you can actually see him processing exactly the same and putting it into his applied area.
Yep.
And going, I know what you mean.
Yep.
Even though you used those words, I know exactly what you mean.
Yep.
And this is how it sits when I'm working with this person.
Yep. Yep. And I think part of that was because I offered it as a tentative idea. I wonder if this is what's going on here. I didn't tell him that this is what's going on here. And I activated him to think about it, to see it from his angle.
The other thing is too that interaction without the video, because he was probably walking away, he was taking the item away, it would have been that lost moment.
Yes.
Never seen.
Yeah.
And it was only because of the video there that he could actually go, I received probably a negative response from this person and I won't try that again. But yet he learned from this maybe that there was something really positive going on.
Yeah, definitely. I think very much in the disability field, if you get a seemingly negative response from somebody, you tend to or we're indoctrinated to just walk away, to leave the person alone because they're saying no. And this is playing with an idea that there's gradations of no, that we can work with. So just from these 2 very short clips, he's now thinking from a way of I'm working, because at first when he did the video, he thought, oh, there's nothing in there, that was terrible. Showed him the 2 clips. We're now seeing somebody who he previously thought wasn't interested in interaction, who is now interested in interaction, and a person who expresses distress, but that doesn't mean no and go away. Dr. Meredith Prane has a very great saying around this, that they're not rejecting me, they're rejecting what I'm doing right now.
Yes.
So you can see that there. So just from the 40-minute conversation that we had based on 2 very short clips, Luke actually developed his own working point. So I asked him, what do you think, or what will you work on now?
So, just from what we were looking at today, what sort of things might you think working on a bit more with him?
Working on the fact that, or me realising that it is difficult for him.
Yeah.
I've asked him something simple, but it is difficult.
Yeah.
Like, he can do it, but it's going to be difficult. Like it.
Yeah. And it's not a flat out refusal, it's just...
No, it's just, I don't know, like,
Yeah.
So just accepting that and trying to work with it.
And naming that, just
Yeah,
saying,
I'm naming it,
it's, a bit tricky.
So in that, I've introduced this idea of naming, that you can just say what people seem to express, people seem to be expressing to you.
Right.
So, and he's come up with his own very concrete thing to work on. To work on understanding that things are difficult. So,
And an understanding of that, he's got and so this was all out of the first 10 minutes. Okay.
So we've done the first 10 minutes. I sat down and had a look at the tape, and then this is a 40-50 minute session that I've had with the support worker.
Okay. Now, if we move on to the next one, how far apart did you video this one from the last
This was
one?
about 3 weeks later. Okay, so I've done the same thing, another 10-minute video, and this is one of the clips that comes up. So that clip's a bit longer, but you needed to sort of have that length to get the whole story. And you see an incredibly skillful support worker there doing a lot of using principles, whether he's known about these principles or not. He's waiting, he's expecting, he's naming and saying, oh, it is difficult, isn't it?
And that's something he learned from the first.
Yeah.
And he's gained that and he's using and applying it.
Yep,
Mm.
definitely. And I don't know that he's thinking about it consciously. I think it's moved into a new habit of relating. Yeah, because he's seen that it's worked.
Yeah.
He's seen it's worked for himself.
And this is the relationship improving by that small 10 minutes of
Yep.
video and
Yep.
analysing it.
Yep.
Yeah, that's one big thing we've learned from the first time.
Yeah.
He does want to do it. He's not
Yeah.
really that distressed and go away. He doesn't.
Yeah.
It's not really. although it may seem that way from a distant view. But yeah, he's keen to get involved in stuff, and you just need to understand that he will take a bit of encouragement.
Yeah. It just plays hard to get a bit.
Yeah, he does, yeah.
Now, this might look very sort of casual, but the need for me as a guide to actually just sit back there, to listen, to know that he'll come to an understanding himself. His understanding. It doesn't have to be my understanding. And that can be one of the most difficult things as a learning practitioner or as a developing practitioner, is to stand back and not try and teach. So then we see, this is 2 months later, so he's had three sessions with me, 3 short sessions.
Where are you going to put it? No. Alright. Where should I put? You don't want it? No. Okay. Thank you. Thank you. How about this?
And what I love about that clip is it's things that I never would have anticipated. Things that he's able to do that I never knew that he could do. But they're just coming out so naturally, and yeah.
And so what does Luke, do you get feedback from Luke about this one?
Yeah, certainly
Let's
did.
have a look at that one.
Yeah.
That was even different to a few weeks back, or when he was doing it, he was just, did seem like more of a copying me.
Yeah.
But then, and same with when I used a while back asking him something, you know, I would probably go, you know, do you want it?
Yeah.
And he'd sort of just nod, unsure, nod, but and just copy.
Yep.
But now I just talk to him, and he's listening, taking it in, understanding it, and then
responding quite quickly.
Yeah, quickly and definitely.
Yeah.
The real depth of relationship starting to occur from what each other are learning from their interaction.
Yeah, definitely. And you can see that Luke's the expert in this situation, not me. He's the one that knows Craig. I'm just there to guide him, to deepen, to try out new things, to name, to say what's going on, to recognise his skill and the outcomes of his skill.
Shall we give Craig the last say?
All right.
So what can this do that I can't do?
Gotcha.
And actually, there's just one other one, just a reflection from Luke about the process. But how's the process been for you?
Oh, it's fantastic, yeah. It's been really good. Yeah, just really eye-opening to how like simple little things can just build and build and build. And the confidence to try things. Just understanding his communication methods, I don't know, acknowledging that things can be difficult for him, and just how detailed one little interaction can be, how many little things are in there that can influence him. And yeah, stuff that you can, principles that you can use with everyone.
Yeah, definitely.
So yeah, it's been really, really good. Yeah, I think I've learned a lot.
So, a really good success story. You can see that both Luke and Craig got a lot out of the process.
Absolutely.
Yeah.
Absolutely.
Yeah.
Very visual. And that visual part's a fantastic learning tool. Seeing it is better than somebody trying to talk or articulate it in words.
Yep.
To actually see that happening is so much more real.
And involving people in the learning, because there is a quote by Abraham Lincoln, I think, that says something along the lines of along the lines that if you just try and teach somebody, they only learn it so much, but if you involve them, that's when they really get an understanding.
And we've certainly seen a very joint project here from being a facilitator or to guide that person.
Yeah. Yeah.
Thank you very much for your
pleasure.
time.
My pleasure. And I think it's also worthwhile mentioning that it was quite a transformative process for me. So going from being an expert who liked to tell people and share wisdom to being somebody who can support and guide other people for developing their wisdom.
Fantastic.
Very worthwhile.
We could all take a leaf out of that book sometime.
Yes.
Thank you.
Thank you.